Hello doctors, this video is for those doctors who want to start their aesthetic medicine surgery practice or hospital or medical setups who want to add an aesthetic medicine and surgery division into the existing medical setup. I'm Dr. Vivek from ISAMS, International Society of Aesthetic Medicine Surgery, which offers certificate and fellowship training programs in aesthetic medicine and surgery. Dear doctors, aesthetic medicine is a very competitive field but a very popular field. You got to be the best in the field of aesthetic medicine surgery to compete with the existing doctors in your city. For this, you have to learn from the best of doctors in the field of aesthetic medicine surgery. We have a faculty of top-class plastic surgeons, dermatologists in the field of aesthetics, facial surgeons, and aestheticians together. As I told you, you got to be the best in the field of aesthetic medicine surgery to compete with the best. So you have to learn from the best, the people who have great experience, great intelligence to make you learn faster. So we have both theoretical component of this training and a practical component of this training. Theoretical component of the training, we mostly finish on the phone itself. We give you reading materials, we talk on the phone, you send your patient's photograph, our doctors, and you treat them gradually over a period of 1 year. So that it's not just doing a workshop with a PowerPoint presentation showing you 2-3 patients over. No, it won't work that way. You have to be in touch with the faculty for the whole year. You have to send the pictures of your patients, your clients, your known one, and treat them in supervision of our faculty. Then over a period of 6 months to 1 year, you get a great experience. Do no harm is the first fundamental. Go slow is the second fundamental. So let's talk some unique point about ISAMS training. First and foremost, when we start aesthetics training, first we have to understand the three-dimensional facial aesthetics. So what is epidermis? What is dermis? What is the role of epidermis in skincare? Like epidermis can give you glass glow skin, youthful skin, younger skin, smoother skin, lighter skin. The role of epidermis in aesthetics. You got to understand the aesthetics of epidermis at the cellular level, at the molecule level. Because you just cannot put water and products, it will go inside. You should know about the science of skin permeation. How do you push the products inside through electroporation, antiporosis, use of salicylic peel to dissolve the intralipid membrane. So understanding epidermis in detail, because epidermis is what looks outside. So we call these aspects of aesthetics as texturing. Improve the texture of the patients. Uneven skin tone, improve it, glow it, smoothen it, soft it, lighten it. So you got to know not just the anatomy, the devices which work, but how do these devices work? What makes a particular skin good or bad? Number two, the cellular and the molecular level you have to understand epidermis. How to retain water. Like when you take a bath, you feel so fresh, clean, soft, smooth, hydrating. But why not when you go out in the sun? So you have to retain water in the epidermis. What are the humectants? How do you push the products inside? Then comes collagen at the dermis level. So dermis is all about suppleness, the collagen. So there are multiple ways like HIFU, MNRF, needling, injuring, radiofrequency, biofillers, PRFs, and so much. Direct collagen introduction to your skin, fillers. So there are a lot of stuff. How do you make the lazy fibroblast growth factor into dermis to active producing collagen? So collagen is all about elasticity. So there are multiple ways. Now once you know the principle, how does this device work? You should also know the ingredients of all the product. You should not say this works for this works for that. No. You should know what ingredients does what at the level of epidermis or dermis, you know. So then you can choose the combination products. How to choose fragrance-free products, non-allergic products, non-comedogenic products. So you should know which ingredients are causing the problem or which ingredients are rectifying or correcting a problem. So you should know at a chemical level, at a molecular level, details about the ingredients in a product. Okay. So this is talking about cellular, molecular, and the principles of device. How do they affect your epidermis and the dermis? Now after the dermis, we're going to talk about the ligaments, the SMAs. How do you tighten up? How do you rejuvenate them? What are the devices? What do you do? Then we comes into the muscle, the fascia, the bone. See, bone is important. With age, what changes happen? The muscle, as you know, in the face, the muscles are directly attached to the dermis because we have muscles of facial expression, muscles of mastication. So you got to know which muscles go where, which is the facial artery going where, which is the supraorbital, supratrochlear artery going where are the nerves, where is the SOFI, the superficial fat under eye, where are the deep fat in your face. So thorough anatomy you should know. When you see a client for aesthetic services, the moment you see him, so not just externally, your eye should be like an X-ray or a scanner. You should be able to see up to the bone. That's the importance of 3D facial anatomy, what I was talking about. Then we talk about if there's a hollowness, deficiency of filler, what do you use? Nano filler to fill it, hyaluronic acid filler to fill it, different types of filler to fill it. Then, as I told you, not many people are working on the muscles, because if somebody is smiling, he's anti-aging. If somebody is sad, it's aging. So muscles play an important role. Not many people are working in the field of toning up the muscles. So facial aesthetics is theoretical, is very, very important. Thoroughly understanding at physical level, cellular level, molecular level, ingredients of different products, principles of working of different devices. Then once you know this, you can easily play with different types of patients and different types of problems. Like you're going to get acne, you're going to get scar. So scar substitution is fine, but it is the monothreads which do dermal substitution with a special needle, not the regular no-core needle. No-core needle does subcutaneous substitution. So these are the finer points. What is biofiller? Through your own blood, we can create a biofiller. It's cheap, your own blood, it's natural. So instead of a normal filler, we can use this for rejuvenation. It's great for periorbital work, periorbital hollowness, periorbital hyperpigmentation, periorbital fine lines. So you got to know, is this periorbital hyperpigmentation due to the veins? Is it due to the loose skin? Is it due to the shadow, or what? What is eye bags? How they form? So you should know complete pathogenesis. Anatomy, physiology, pathogenesis of problem, and then work on it. Not just selecting this machine for that, this machine for that, this product for this product for that. No, you're not going to become great with that. Understanding the principles of working of devices and products, understanding what the hell is happening actually, why is this person aging, why this uneven skin tone. So you're going to get acne. We do pus culture also. And the major issue with the acne management is, how do you prevent a scar formation? Anybody can treat acne, although it's controllable. But how do you prevent scar formation? What are the regenerative products you can use to reduce the formation of scar after an acne? Like before period, 7 days, a woman may get an acne because of excess, due to hormones, there's an excess sebum production. So how do you make sure that 7 days before that woman reduces the sebum on her face through salicylic peel or through microdermabrasions or home-based products, so that she doesn't get that acne and it will continue for the next month, then again she'll get an acne. So you have to be the best. You have to prevent problem occurring in your clients, in your patients. Then you will be known as the best in the industry and the people are going to flock onto you. So friends, this was a brief about facial and body aesthetics training, both certificate and fellowship offered by ISAMS. So WhatsApp now to the below number to more about the date, schedule, fees, qualifications, legality, eligibility, etc. And not just this, we help you A to Z. We get you the doctor, the manpower, the instrumentation with 1 year support. So you're not just doing a workshop and going back. We are there with you to set up your center, start your practice. So see you soon, doctors, with another video.